Peace and love, peace and love. What's going on? I am Johnny Prince, and you are now tuned into the Be Clear Alert podcast. Thank you so much for rocking out with me. This has been an super dope, amazing journey, man. This thing is growing and growing and growing, and I want to thank y'all for really rocking out with me. I appreciate y'all, man, for the love and support. Everybody tapped in. All the shares, all the likes, all the comments. Shouts to everybody coming in the live right now. Shouts to my son, shouts to my sister. Good evening. What's going on? Hey, listen, I got 100 followers on Instagram. That is major. This thing is growing organically, and I appreciate y'all, man. This is I really try to bring some different, something organic, something unique to you. I don't want this to just be a regular podcast to talk about anything. I want to, bring solution. I want to bring people up here that'll help you really grow and build, self-esteem, business, whatever you're trying to do. I just want to bring people up here to make us better, to give us advice on from their expertise, advice on things and whatnot. So, that's my goal. That's my aim, and that's why I named it Be Clear Alert, because I want you to be very, very clear, when you're tuned in to this podcast, because it's to be clear. All right. That's what it is. But once again, y'all follow me everywhere at Be Clear Alert Podcast. I am live right now on YouTube and Twitter. So make sure you follow me. You can go to the Instagram at Be Clear Alert Podcast, YouTube, Be Clear Alert Podcast, Instagram, Be Clear Alert Podcast, Twitter, Be Clear Alert. Okay. So just make sure you share. This is going to be a very, very unique show. Good evening, everybody. This is going to be a very, very, very unique show. I got my good brother, Mr. Marcus Jones. He is an amazing dude. I met him a couple years back. And it's been love ever since, man. And I am glad to have him on. He is a licensed clinical mental health counselor, and he's been doing this thing. And we're going to tap into him. We're going to get all the information that we need to get, because there are a lot of us out here that are really going through it. So we're going to all of the questions we're going to ask, that's going in the comments. Don't be afraid to ask the questions. We're going to get to it. We're going to definitely get the help we need. For real. But in the meantime, please, before you start anything, please subscribe to the YouTube. If you're viewing me on YouTube right now, please make sure you subscribe, hit the bell, so you can get the notifications on any video that I drop. Please do that, and please share. This is a very, 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 very important show. Let's get this out of here. Counseling student. Okay, here listening and learning. Look at that. Miss Odessa. Thanks for tuning in. Thank you so much for tuning in. Appreciate that. Without further ado, man, we gonna bring this brother on. And again, he is let me turn this down, because I want y'all to see my eyes. You know what I'm saying? I want you to see my eyes instead of the light. You know what I mean? Great brother. We're gonna get more into him. And without further ado, please, let me see. Let me get that right. Let me get that right. Help me welcome my brother, Mr. Marcus Jones. Man, what's going on, sir?
Yes, sir.
Oh man, it's so good. I'm glad that you're on. Yo, right quick, center yourself right quick for me. Move to the left, I believe. Let me see. Yep, like that. Yeah, you're right. Yeah, I want to make sure that everybody. Yeah, there you go. That's good. You good? I want to make sure you're good. That's what it is. Right. Man, I appreciate you, brother. What's going on, sir? How was your day, man? How's everything going, man?
All is well, man. All is well. Spent Martin Luther King Day working, brother.
Yeah, I did too. Yeah, I did too, man. So yeah, I was just telling the people, man, how we met a couple years ago, man, and at a previous situation, and I think we interviewed there, and you gave so much insights, on mental health, and how to really maintain it, and how to really overcome some things, how to work through things, and trauma and all of that stuff. But first, I want to get into Marcus Jones. Like, who is Marcus Jones?
Man, I'm a man that's living in his purpose, man. If I could sum it up like that, I done worked so hard to reach this point. It took a while to get here. It certainly was earned and not given. Been through a lot, but I'm here. I'm glad that I'm in this position. To be living in my purpose on my own terms.
Yeah. That's what's up. That's what's up, man. So, what, you're a licensed clinical mental health counselor.
Licensed. Yep.
How long you've been, how long you've been a licensed mental health counselor?
So I've been licensed, fully licensed for the last 6 years.
Okay.
Then I've been doing counseling for the last 11. I was associate licensed.
Okay.
I was actually a certified alcohol and drug counselor before I even became a licensed clinical mental health counselor.
Oh, wow. So you went to school for that, obviously.
Yeah.
Okay. What school you went to?
So I got my master's in mental health counseling from the University of Southwest.
Okay.
Currently finishing up my PhD at West Georgia University.
Oh, snap. That is what's up. How's that going, brother?
It's a mountain. It's a mountain. You know what I'm saying? So it's a mountain, but I'm loving every minute of it. I'm loving every minute.
So once you get your degree, now what's expected after that?
So my goal right now, so I'm an approved clinical supervisor. So I do supervision for individuals who want to become licensed or individuals who are associate licensed. My overall goal is not to fully step off the couch, but to get to the point where I'm just doing that part-time and I'm helping building other counselors and hopefully get to a point where I'm able to teach at universities, engage in further research and things like that. So that's the 5-year goal. That's the 5-year goal.
That's a 5-year goal. Okay.
Yeah.
That's what's up. So when are you expected to graduate?
Looking to graduate next year.
Next year?
I should be done next year. Yeah.
Oh, this is what's up. Yo, we talk Dr. Jones soon, baby. I'm claiming it, you know what I'm saying? That's what it is. Dr.
I appreciate it, brother.
Yes, sir. Yes, sir, man. Listen, I remember years back when we met, man, and you were talking about, what your goals and everything. And to see you, 4 years later, still, really into it and really doing what you set out to do, man. That's super dope, brother. Yeah. And I'm proud of you. For real, because I can only imagine how difficult it is. You know what I mean? Like you said, it's a mountain. Yeah. And the goal, with you wanting to help other, counselors is super dope, brother. And and your blessing comes through that. And this is why you're gonna be Dr. Jones next year. You know what I mean? And I can't wait to be there to celebrate with you. You know what I mean? That's what. I'm waiting for that. I want to be there. You know what I'm saying? However you get it, I want to be there, brother. For real. Yeah, man. So let's talk about, all right, mental health. So a mental health counselor. So what is a licensed mental health what is the job of a licensed clinical mental health counselor?
So we work in many facets. So I've got experience working in multiple areas. So I've worked in emergency departments where I've done emergency room assessments for individuals who were suffering an immediate crisis. I've worked to the next step where typically individuals who need to be held involuntarily in a psychiatric hospital, I've worked in that setting. And so in that setting, typically you have what you call a case manager or therapist, unit therapist, or you have people you can work in the outpatient realm as a therapist doing groups, some family. Most outpatients are just groups and some minimal family therapy sessions. Then you can I've worked in jails, I've worked in prisons. Working in prisons, you're doing for the most part suicide assessments.
Oh wow, okay.
And then you might be doing some individual work, but it's very short, brief individual work. You're not doing any long sessions. And then there's community-based counseling where you're actually doing counseling with individuals depending on the demographic that the company serves.
Okay.
And then there's private practice. That is where I am. I'm in private practice where I evaluate clients, I consult with clients to see if they'll be a good fit for therapy or therapy interventions. So there I employ different treatment modalities to address different situations, to address different issues and things like that. So I may formulate a diagnosis and then treat whatever symptomology that may suggest that particular diagnosis.
Wow. Wow. All of that. That's the job of a mental health counselor, pretty much.
Yeah.
Wow.
Yeah.
So you've been in many settings. Yeah.
It's layers to what we do. It's a lot of layers to what we do. I've worked in multiple. I probably worked in almost every facet you could work in.
Wow.
Almost. I'm not going to say every facet, but almost every facet I probably worked in. Again, from psychiatric hospitals to prisons and jails.
Okay. So is it safe to say that you're like the person that someone talks to before they go to therapy?
No, I actually do therapy.
Oh, okay. Oh, my bad.
So
let's get that straight. See, that's what I'm saying. Okay.
Yeah, I'm the actual provider. I'm the private practice. I'm the actual provider that they come see. Yeah, they can look. You can find me on different platforms. You can find me on Psychology Today. You can actually Google me and I'll come up, or you can put in Holistic Partners Network. I'll probably pop up on Google. So, yeah.
Oh, okay. What's the name of your private practice again that you're part of?
So the LLC is Holistic Partners Network. The actual practice name is the Psychosocial Cafe.
Oh, okay. Got you. So what inspired you to get into this line of work, to get into to become a mental health counselor?
Man, I tell everybody I fell into this. It's great. I didn't know nothing about mental health until I started working at a psychiatric hospital 21 years ago, maybe 22 years ago.
Wow.
Yeah, I started working at a psychiatric hospital. I got a job at this hospital, and I wasn't even planning to work in psychiatry. I was what you call a sitter. Well, technical term, patient attendant, but they call us sitters. We just sat with patients to make sure they were safe. And one day they said, we need a male down on the psychiatric unit. And so they was like, Marcus, go to the psychiatric unit. And I was like, what is a psychiatric unit?
Wow.
And they all looked at me like I had 10 heads. And so I went down there and I seen what a psychiatric unit was. And I seen certain things. It was like, oh, okay, that's what this is. All right. And so from there, I just got intrigued because I've seen people engage in different behaviors. People hearing voices and talking to themselves. And I just got really engulfed and interested in what makes the brain do things like that. And can that person really be helped in some capacity? And the first thing I ever read, it was at that time, I might be telling my age, but the first thing I read was the DSM-3. It just changed over from the DSM-2. It was the DSM-3.
Okay. Wow. So it kind of fell into your lap. Wow. And then it was.
It just kind of fell into my lap. Yeah.
Wow. That is amazing, man. What is there one thing that you're finding out, administering therapy to people? Is there one particular thing?
There's multiple things, actually. There's a lot of untapped areas now that mental health still needs to get to catch up with. And there's more coming along. Mental health is ever changing and ever evolving. You can't just graduate out of college with your master's and think that that's it, because that's not it. In fact, if you think the textbook is going to get you, it's not going to get you to this place. So, just finding out that there's many different things with people that need to be treated or need to be sourced to some sort of psychosocial issue that they've had either in their past or in their present that they might be avoiding.
Wow. So let's talk about trauma, right? Because I think that, even a lot of people that I know that are dealing with, past trauma, childhood trauma, sort of, trauma, and it's very, very difficult for them to, just maneuver through life with this trauma.
Right.
I realize, with the close ones that I know and love, that they store a lot of it. And again, trauma, there's layers to it because it's stored here, and it's also stored in the cells, like in your muscles and everything. Talk about like what is like the different levels of trauma and how important it is to really tend to it and try to release it and what is the best thing you can do for someone dealing with trauma? What is the best thing someone can do for dealing with trauma?
So there's multiple aspects to trauma. There's secondary trauma, which you experience either by watching something or seeing a life or death or life-threatening situation or some sort of abuse happen to somebody else. It's sort of synonymous with vicarious trauma, but vicarious trauma was a term actually coined for individuals working in a helping field. When we hear somebody else who has went through a traumatic experience, or we hear those experiences multiple times, we might experience what you call vicarious trauma. Then there's trauma, which is an death experience or some sort of extreme stressful experience that may have caused an imprint, that may have caused this psychological imprint.
Yeah.
So then there's diagnosis to deal with that, right? There's post-traumatic stress disorder, which was actually derived for veterans going into war.
Right.
When they would go into war, they said they would cross over. They would cross over onto the dark side, and what that meant was they reached a part of their brain in their mind where they sort of engaged in sort of this dissociation where it didn't matter whether they lived or died, because they had to go into that zone of not knowing and not feeling in order to get through the war that they were in. Okay. And so there's different levels, different degrees to trauma. Trauma is very much layered. How trauma is treated? Trauma is treated in a lot of different ways. There's hypnosis. There's EDM, what you call EDMR, which is still fairly new intervention. Then
what is that?
Then I'm sorry, say that again.
I said, what is that? EDMR.
EDMR is, oh my God, I can't even remember.
It's an acronym. Okay.
It's an acronym. I can't even remember my head. I'm drawing a blank. But EDMR is sort of almost like a form of of hypnosis, but not exactly hypnosis.
Okay.
But you're helping people through different movements, such as one is synonymous with eye movement. Okay. And so that's a trauma intervention. And then other theoretical bases are dialectical behavioral therapy and cognitive behavioral therapy interventions. And there are other interventions. Acceptance and commitment therapy is another intervention that is typically used for trauma. But to answer your last question, what can an individual do to help themselves, or how can you help someone who has experience?
Like a daily practice, you know what I mean? Like they can do.
Meditation is really good. Meditation is really good. Having a practice of staying mindful. A lot of people have a difficult time with meditation because they say that their thoughts race. And so what I would say to that is allow your thoughts to race, allow them to run through. because it's when you start to fight against those thoughts, that's when you start to struggle with the meditation. Just allow those thoughts to run,
right?
Because it helps you to think. But meditation is really good. Doing things to stay in the present, breathing exercises. One thing that I teach people who dissociate, which is your brain's way of protecting you by shutting down when there's extreme trauma or stress. I give people the technique of the five senses. Five things you see, four things that you hear, three things you could touch, two things you could taste, one thing you could smell. So I give them the five senses because it helps them stay in the present. And actually I give this to individuals who may experience extreme anxiety, who may be experiencing sort of like a mild panic attack, so to speak. But those are things in extreme situations. But the daily thing, I would say meditation and process through emotions. It's important that we process through emotions and what we feel.
Wow.
What has happened very much so and especially in our community, in the Black community, right? We've held things in so much. Mm-hmm. We've grown to have this notion that holding things in, being strong and resilient and getting over things. Mm-hmm. And so we've held that premise, and what has happened is those emotions and that emotional turmoil starts to bleed out into your behavior.
Right.
It starts to bleed out into things, right? It starts to bleed out into your behaviors.
Yeah.
And especially men.
Yeah.
Let me say this. Most Black women are really good at expressing their emotions. Mm-hmm. Most of them are. Black men are not that good at expressing emotions. We're starting to come along, but we are not that good. In fact, research shows that Black women sit the lowest at the totem pole when it comes to committing suicide.
Mm. So why is that? Why do you feel that is?
Because for the most part, they've had to handle their emotions. They've had to handle their emotions for the most part.
Well, talking about men, why do you feel that men have a difficult time expressing?
Oh, because of stoicism and social ideologies. When you fell on the ground and bumped your knee, they told you not to cry. They said men don't cry, or they said man up, right? Within a social framework, if a man shows his emotions, he's associated with being feminine.
Yeah.
We've contextualized emotion as being masculine and feminine. Think about whenever you talk to women might say, people say that I'm like a man whenever I express my feelings and stuff like that, right? Because we've contextualized it as masculine versus feminine when you express your emotions. And so by these social ideologies, people have become intolerable of men expressing their emotions. And so ultimately, as we get older, what we see is that the world don't want to see a man being emotional. So we don't experience it.
I think now I'm seeing a lot more because, I'm seeing there's a lot more spaces being built for us to express our emotions, today. You know what I mean? So there's a lot more men that are expressing themselves because there's an awakening. Yeah. There's an awakening happening. And right. And I like that. And that's what's going on. And I really like that. And I think that we learned that we have to create these spaces for ourselves because it's difficult to rely or get it from anywhere else. Women have these spaces all over the place. That's just what it is. Yeah. They can go pretty much anywhere and get any types of help for anything. Us, we don't, because there's an expectation of us to, really, and to be there, to be the space. We always have to be the space. Yep. You know what I'm saying? But there's not many spaces for us. But we're coming along though. I see a lot more women out here that is really, really helping a lot of black men out. They're coming out with these posts and they're black men, and we love you and everything. I've seen a whole lot more of that, whole lot more videos, whole lot more podcasts, whole lot more people that are really encouraging us to really express ourselves and really showing us and teaching us and telling us that it's okay to feel, pretty much. It's okay to feel, you know what I'm saying? I think the issue though is that when we, because you can become overly emotional. We don't want an overly emotional man. We want you to still to be able to when it's time to protect or it's that time. When it's time to really, when it's time to really, really be a man. And I'm not saying that you're not being a man by not being emotional. Please, I'm not saying that. But there are times where your manhood is needed and it's okay to feel. But we don't want you to really, really sit in that emotion at that point in time. For example, say you come out, the parking lot, say you come out the store, come out or whatever, and you got a flat tire, right? And your family with you, whatever. And, and it's pouring down, you got to get your family out of there. And it's like, you start to cry. You start to have these emotions that come down. Now, I'm not saying to not feel it because I can understand that very moment. But that moment, we needed to get your family out of safety. And I think that there are moments like that men are having these breakdowns. And like you said, I think it's stem or it's coming from men not being able to express their emotions. But at that moment, I think is the time to really get your family out of safety. Get your family into safety at that moment.
Okay. So this is what I would say to that. It's depending on the context.
Yeah.
Now, we all have our own, we all have different frames of reference. Okay. Whether what it is how we learn, how we're adapted and things like that.
Yeah.
We deem there is, how like the US dollar, the dollar bill, the paper dollar that we have, there's a collective agreement that is a monetary value for our survival. It's a human collective agreement, correct?
Yeah.
We all have human collective agreements as to what's morally right and what we think maybe the best possible action to engage in a situation. Okay. When somebody is outside of that collective agreement, there's something further or deeper that might be going on there.
Definitely.
So what popped into my mind when what you described was this is a man who's probably tired and exhausted at life because he's having a hard time.
Absolutely.
He had to pay for that flat tire.
Absolutely.
To get fixed. And so he knows. So there's other things that
to factor in.
There's other factors to factor in as to why he needed to take that moment to cry and release.
Definitely. No, I agree. What do you? Let's talk about anxiety now. Now, anxiety is that stems from trauma?
So it could. It's a part of trauma, or people could just experience anxiety. There's different levels to anxiety. And so with anxiety could just exist. There's a diagnosis that we call generalized anxiety disorder.
Okay. People
can experience what you call social anxiety. Okay. And so anxiety, the emotion itself is actually anxiety is not a bad is not actually a bad emotion. There is a healthy degree of anxiety that we actually should have.
Okay. Let's talk about it.
Because if we didn't, we probably wouldn't pay attention to things. We probably would just go into things blindly. Yep. Right. We would just exist and we would go into things blindly. So there is a healthy degree of anxiety. The increased levels of anxiety are the concern. And so when you help somebody manage anxiety, you help them do just that. You don't try to go for no anxiety. That's not even possible.
Right.
That's not even possible. So what you go for is to help them manage their anxiety and to shrink its capacity. So I once heard a personal trainer say, well, fat cells never go away. Fat cells are just cells that stay within you, and all you're doing is just burning it down. When it inflates, it's a problem, but burning it down, you just essentially burn it down. It never goes away. That's sort of what anxiety is. Anxiety never goes away. You just manage it. There's going to be another time that you feel anxiety or you become anxious. We're just teaching you the tools on how to manage it.
So what exactly is anxiety?
It's an emotion. It's this feeling that we have. What is an emotion? An emotion is comprised of body physiological sensations and these thoughts that we have pertaining to external stimulus. And so when a person think of social anxiety. When a person experiences social anxiety, they're more than likely a person that wants to connect with other people. Anxiety is sort of this, it's like any other emotion. It's this internal experience that sends us messages. You ever had a gut feeling? Right? You ever had that feeling, well, I shouldn't go in there or I shouldn't do that? That's anxiety talk. Right? So what it really is about, if you could get people to change their insight and how they see and view emotions, they may be able to better manage their emotional experience. And that's what I do. I teach the emotional landscape and get people to see emotion differently than just an experience that you judge as good or bad.
Wow. So in that example, how do we know that it's anxiety and not intuition? Is intuition anxiety, or we just call it intuition, or is it really anxiety?
It's
intuition and anxiety.
Yeah, it's your body's experience. It's whatever we determine. Whatever it is, we have the capacity to determine whatever that experience is to us. What is it that you feel? What are you experiencing? And I teach people to deal with the body sensation first and then process through that emotion. Don't forget to process through the emotion. Don't forget to process through what you experience, because you got to get the information. It's like your alarm clock, the body sensation, the alert that you get in your body is like your alarm clock coming on to wake you up in the morning. The emotion is saying, wake up, something happened. This wasn't cool. Or hold on, don't go in there yet. With the body sensation, got to turn off the alarm. Now let me figure out what information I'm getting out of this emotion.
Wow. So intuition is anxiety, pretty much.
So to speak. So to speak.
Right.
It's really, at its core, it's really subjective. But
right.
But essentially, you get this feeling of something isn't right.
Right.
What do we see? Intuition, right? What do we say when things happen? And we already had this feeling that something happened, and we're like, I knew something told me not to go into that situation. Something told me not to do that.
So that's the healthy dose. That's the healthy anxiety you're talking about.
All emotions are healthy. All of them are healthy.
In regards to anxiety, you're saying that there's there's such thing as healthy anxiety and anxiety that's not
and
healthy.
And there's just an increase. What's not healthy is how you're how you're experiencing the level of anxiety. So when it's increased and you have this increased level of anxiety, as a therapist, I want to deal with the reason why your anxiety is so high. I'm not really dealing with the anxiety in itself,
right?
To say, let's get rid of the anxiety. I just want to know, why are you on 10?
Right.
Basically, I'm like, why are you on 10? Let's get you back down to, let me show you how to get back down to a 2 or 3. What is you seeing in a situation? What have you experienced in your past that's related to this, that's got you at a 10? Because right now, this situation look like you might only need to be at a 2 because you're not in danger. Let's deal with the exacerbation of what you're experiencing.
Okay. I want to get into fear, right?
Okay.
And the fear, how it's allowed to have so much power in a lot of people. And I've noticed that people are creating more trauma for themselves out of fear. Out of fear of, the unknown, fear of things actually working out, things of actually not working out, What do you say because fear is there like is there such thing as being too fearful or too, to where it really stops you from even like going out? I guess you call that depression. I don't know, but I know that fear really stops people from really just living life, just doing anything. So what is your take on fear itself?
Fear is sort of a repulsive emotion, or that emotion that you feel like your needs may not be met. Mm-hmm. Right? Everybody sometime at some point will experience a level of fear, whether they want to admit it or not. Fear, again, it's not a bad emotion. Mm-hmm. In fact, fear helps us to be more mindful, to pay attention.
Right.
Fear is what helps us to take precaution. Mm-hmm. When somebody experiences an increased level of fear, then we may need to address the reason for that overgeneralization or exacerbation of fear. Mm. You've heard me talk about schema before. Schema are the things that sit in the file cabinet of our subconscious.
Yes.
If you experienced a level of trauma, say you've experienced a level of trauma where you were in a house fire and the whole house caught on fire, and it was a near-death experience. And then you go over a friend's house and they turn on the fireplace, the smelling burn of the fire.
Right.
And the sight of the fire inflaming may bring back the same fear, the same fear that you had when you were in the house fire, because the fire is reminding you of that traumatic experience.
Is there a practice in that particular example, right? Is there a practice they could put in place to help them enjoy the fire?
There's a practice there's a practice to help them decrease how they respond to
the fire.
Right. We want to help. The goal is to help people recognize when they're no longer in danger. Research says that what really happens is there's the parts of the brain that could be affected. Most research say that the part of the brain is called that we call the amygdala is is that part of the brain that holds researchers and a lot of psychologists. Actually, this is actually being argued in other places, but by other psychological research. But most research says that the amygdala holds the strong emotion, and there is this change in that part of the brain whenever trauma happens. There's this distortion that happens. Animals have an amygdala, but the amygdala in an animal is larger than that of a human because it's normal, because they're either hunting or
being hunted. Right. Wow.
Right. Ours is smaller because we're not in a jungle, and there's no need to continuously feel that we're in danger. And so when somebody feels that way, we've got to address what might be causing, what situation in their minds this may be related to that's causing that excessive amount of fear.
That's interesting you say that, because I can, even from 2008, when we had that recession, and just keeping on going until the pandemic, and could it be a possibility because we don't use that part of the brain, and because more people have lost their houses, more people lost their jobs. People out here, we struggling out here. There's a lot of us really struggling, and we went from doing really well to doing really bad. So now, could that be the thing? Could that be what's going on right now? What did you describe that? The amygdala?
The amygdala.
Amygdala.
It holds a strong emotion.
Right.
So to answer, what could be going right now is that people experience a traumatic experience, and so that fear, once they hear the news talk about the economy, once they hear housing rates are starting to go up, once they hear things such as war and things like that, they start associating and saying, okay, here we go. We get ready to come back into another experience, right? There's when they say there's a new strand of COVID, people may be panicking, about to be another shutdown, right? And so it's because that experience has affected people so much so, and caused so much of a stress on their brain that it's sort of implanted it. Anything that smells like it, sounds like it, they react to.
That's what I'm getting at. And I think that's what's going on today.
Yeah.
Wow. I want to touch on happiness, right?
Great.
I'm realizing that because a lot of people confide in me. I have the ability to really affect people. I don't even know how you describe that, but anyways, when they sit down with me, and I'm noticing that there are many people that are just concerned about what makes them happy, doing what makes them happy, but at the same rate, they're doing what makes them happy at the expense of their soul, at the expense of other people, meaning they're using other people and not really caring about the outcome as long as they're happy, creating much more trauma for themselves. What do you say to that someone is more concerned about their happiness and not necessarily their mental health? That's what's going. I'm because I see the posts. I see people posting all the time. I know some of the people, and I know that some of these people are dealing with anxiety, depression, and stored trauma that they haven't even dealt with. So much trauma. But their focus is just being happy. I don't care. Like, there's a different I don't care, right? There's like, I want to do this and I don't care. It makes me happy. But it's creating more trauma for them. Not realizing.
So that is what you would call, sounds like what you're explaining is what we would call experiential avoidance. And so what that is people are determining that the emotions that they feel are bad and they just want to feel good. So they become obsessed with feeling good, so much so that they'll try to fight or avoid feeling bad and do whatever they feel is necessary. People do it that's what people do when they have an addiction to drugs, to porn, and to sex.
Right.
Is they use different measures to escape those uncomfortable emotions so that they can feel what they determine to be good.
Right. And like you said, I think people are every emotion is good to feel. It's good to feel the emotion, whatever the emotion is. We just don't,
whatever it is.
As long as it don't land you in jail or doing something bad, we don't want that. But it's important to feel it. It's important to acknowledge it.
And so that's the thing too, Prince, is when it comes to behavior, a lot of times people fight emotions so much so that they engage in these unhealthy behaviors or maladaptive behaviors. Think about this. When you was in school, you was young, you was in school, you got mad at somebody, they got mad at you, and y'all fought. The reason y'all fought was because y'all wanted to fight because the winner felt like they was gonna feel good after the fight. They did it to feel good after the fight. People really don't process through their anger and those emotions. And so when you start to practice processing through what you feel, you may start engaging in more healthier behaviors.
So it's very healthy to feel, y'all. It's very, very healthy to feel and not avoid certain feelings, right? Because I think the issue with a lot of people today is that they're just trying to feel good, but not allowing to to feel certain things. And that feeling that you're avoiding could be the very one that could liberate you. You know what I mean? The very one that could really set you free or really, really help you, in what you're dealing with. Help you with your anxiety, help with your depression. Depression now. Let's talk about depression. What is depression?
So depression is a mood. It's an emotion. In fact, there are actually psychologists right now that are fighting there's what we call a DSM-5. It's a book for clinical diagnosis. There are actually psychologists who are fighting against depression actually being a diagnosis.
A diagnosis? Why?
Because they're saying that what they're doing is creating what is essentially a mood or an emotion to be an actual diagnosis, and they're saying it's not a diagnosis, it's a mood. So when it comes to depression, oftentimes it's somebody who has a difficult time fully feeling. It's somebody who you may have several different onslaught of emotions, but you're having a hard time feeling them. You don't want to feel them. You want to avoid them. You want to get rid of them. You're resisting and you're fighting instead of just saying, all right, let me deal with this emotion. So when it comes to depression, it's sort of like walking down the stairs, trying to find an open door. And the more you try to find an open door, the further down you go down the stairs.
What an analogy. Oh my goodness. I've never heard it like that. That is exactly what depression is. Going down the steps trying to find an open door. And the further you go, the further deeper you get into The depression, because there ain't no doors down there. Wow. So what are some daily practices that one can do to help manage? Okay, well, first of all, do you agree that they should take it out? The what do they call it? The diagnosis Bible. I heard it say like that.
I'm still
on the fence about it.
Yeah, I'm still on the fence. Because it is something that needs to be very much treated. It's a part of other diagnoses. It can be attached to other things and other diagnoses.
Mm-hmm.
So I'm still sort of on the fence. So I'm not yet fully well researched on that part of it, but it was a peer-reviewed article that I read.
Is it do you understand why they wanted to take it out? Or do you get it?
I could see their view of it being more of a symptom, just a symptom than a diagnosis.
Oh, a symptom of or just a symptom?
It can be a symptom of several things. You've got bipolar disorder, where there's two polar opposite mood states. That's mania and there's depression, right? Would they say bipolar 1 is more so mostly mania? Bipolar 2 is more so mostly depression.
Okay. So what are some daily practices that one can do to manage depression? Or is it something that you can get, is that a mood that you can totally get rid of or just manage?
Let me say it like this. Emotions are like ocean waves. What everybody understands, whether it's a surfer or a parasailer, is that you cannot fight a wave. In fact, if you try to fight a wave, you put yourself at risk of drowning.
Absolutely.
So what do? They prepare to ride the wave. Because what they understand is that the wave will essentially even itself out back into the ocean.
Right.
Sometimes you just got to feel through it and let the wave happen.
So if you have wave after wave after wave, what do you do? That's where the manic come in at or something?
That's where you start to, that's where whenever you start to feel those constant emotions, if they get too much, then it might be time to go have somebody help you out and talk to somebody, right? Like a therapist. But in order to deal, if you're asking for strategies in order to deal with that emotion, some things that you could do if you find yourself in a deep cycle is try to do different healthy things like boosting your serotonin, which is you could run or jog or exercise, right? Boosting your endorphins by finding something to laugh at, boosting your dopamine level. Find something you really, something that creative or something like that you really enjoy doing and things like that.
Right.
But you don't want to forget, once you get to a place, you still want to process. Yeah. You still want to process through the emotion.
Yeah.
You still want to, we've got to get to a place where we're processing through instead of getting over.
Right. That is another issue as well. I think that people are just trying to get over or around it, or, instead of just getting, trying to find ways to get through it. Shouts to Stephanie. She had a question. How do you explain chemical imbalance? How do you explain a chemical imbalance?
How do you explain a chemical imbalance as related to? Could she clarify that?
If you can clarify that, Stephanie, let me know. Type it in the comments, please. We got some great comments. People are really chimed in. Good info, awesome. Let me see. There was another one. Oh, okay. Adrian says we use our school funds to have a mental health counselor in the building 3 to 5 days per week. Have you ever worked in the school?
Yes, I have. I've worked in high school and elementary school. And I think that is something very much needed inside of the schools. Every school needs a mental health clinic.
Okay. Stephanie said in relation to depression.
Oh, okay. I got you. So this is what I can say. When it comes to extreme emotions, what we understand is that a hormone is released in our body that we call cortisol. Okay. Now watch this. Follow me real quick. Mm-hmm. Cortisol controls heart rate, blood pressure, sleep wake responses, and the release of cortisol is the axis release of cortisol releases what we call inflammatory cells in the body that we associate with sickness. Now, everybody has what you call a cortisol. Everybody's cortisol is measured. They can measure your cortisol. It's called the diurnal cortisol slope because everybody has to have a balance of cortisol from wake up until the time they go to sleep. You have to have a certain amount of balance in your body of cortisol. Whenever you experience stress, anxiety, or extreme emotions such as that, there is an increase in the level of cortisol. Well, what happens? You put yourself at increased risk for things such as diabetes, high blood pressure, insomnia, and other associated sicknesses. And so that's what I'll say to that. If she's asking about other sort of chemical imbalances, that sounds more like neuropsychology.
Okay.
It sounds like maybe where she's going, but I would say I would give that answer to that.
Okay.
I don't know if that answers her question.
Yeah. She'll respond. Hopefully that does. If not, we can clarify. Brother can clarify. Yeah. Definitely can clarify. Man, you've been really giving us some real insight, man. And the meditation part, I want to go back to the meditation. What is the best way, or what is the way? She said yes, he did. Very good. Thank you so much. Okay. That's what's up. That is what's up. What is a good way? Okay, someone who's beginning, who's starting out. How should they start?
So let me say this: you should meditate. You should meditate in a capacity that fits you.
Okay.
Meditation is not a one size fits all.
Right.
Meditating to a capacity that fits you. That's the first thing. The second thing is whenever you meditate, you want to allow yourself to feel and run through your thoughts. Meditation is that time and that experience where you're giving yourself that time to do that. And so if you could practice in your meditation that, you'll start to build the capacity of doing it right in future situations, in real life scenarios. Meditation is that practice. Meditation is that practice where you find that, where you're able to find that peaceful place. And so the third thing is don't put too much pressure on yourself to meditate for 30 minutes if you can't sit down for 30 minutes.
Right.
Sometimes you just got to start with 60 seconds and it's okay.
Right.
And then build up to that 30 minutes. Like, it may take you a while. Because somebody going to say, well, I got ADHD. I got to be moving. I got to sit down. I got to do all that. Start out with 60 seconds. That's okay. It's okay. Start out 60 seconds, move up to 2 minutes, move up to 5 minutes, and then just creep up as you start to build your ability to do it. But don't put too much pressure on yourself, because if you put too much pressure on yourself, there might be a time where you just say, forget it. Meditation is not for me. Right. It can be. Right. Meditation can be for you. It's just building your practice up to do it.
I hope that answers your question. No D. She said that meditation is kind of hard to do. I struggle to chase away all of those instructive thoughts. Yeah. So like you said, just start with the 60 seconds. You know what I mean? And,
and also tell her this.
You telling her now.
When it comes to destructive thoughts, and I'm actually finishing my curriculum on this, but I'll give you a piece of it. When it comes to destructive thoughts, those thoughts are typically thoughts that are attached to our level of self-esteem, and that part of low self-esteem. Our self-esteem sits on a plane of low to high. The lower end of our self-esteem is those things that speak to us that say, I am not, I cannot, I will not, it's impossible, and it won't never happen, right? That's the part of our self-esteem that we call the prosecutor. When people say that we can't do, when people say things about us, they speak to our prosecutor.
Come on now.
But then on the higher end of it is our defense attorney. The defense attorney is the person that says, I can, I will, I am, and it is possible, and I can make it possible, right? And so sometimes when you have those destructive thoughts, sometimes in your meditation, you can start saying counter arguments to everything the prosecutor is saying. There's a balance between the two. The prosecutor keeps things into perspective, and the defense attorney motivates us.
Right.
And so find what it is. See if you can go fishing and see if you can grab on to whatever that destructive thought is, and see if you could find a positive thought that counters it.
Come on now. What is one way you can suggest for someone who has stored trauma? What is one way they can begin to, unbag trauma?
I would recommend they go see a therapist. If it's that to that extent where you just haven't even, if it's been a while and you haven't unpacked that trauma in a while, I would say go see a therapist, because it's really tough to unpack trauma that's been held in for years, because it becomes difficult for us to manage it. And that's for anybody. Like it's difficult to manage things. Now you're starting to unpack, because now you're starting to feel emotions that you didn't even want to feel in the first place, because that's why you held that in. Right. And so now when you want to get that out, my recommendation is to go find you a therapist that can help structure that environment for you in order to help you release those things. They can take you through a step-by-step process, because even as a therapist, I'm not helping you. We got to do at least 4 to 8 sessions before I have you even start unpacking that stuff. Because I got to teach you the basis on how to deal with your emotions and your thoughts when we start unpacking that stuff. Let me teach you how to deal with it before we start to release those areas.
Are you for therapy for years and years and years? Is that healthy?
I'm for therapy as long as it takes.
Okay.
I'm for. I tell all my clients, your therapist got a therapist. I see somebody, and at therapy you could do, start out maybe once a week, and then bump it down to every 2 weeks, bump it down to monthly, and then bump it down to having a therapist on call. I got people who just call me like out the blue that I haven't even seen in a year, and they say, "Hey man, I need to get in." All right, that's fine. Come on through. And so therapy can be, the great thing about therapy is that it could be, it's open for you to do that. You have the capacity to do that. It's just all about getting to a place where, you want to get there and actually sit down and unpack some things.
Is there a such thing as getting too much therapy or going excessively? Is there a such thing? Might be a dumb question, but.
No, it's not a dumb question. Some people can become too dependent on the process. I'll say it like that. I won't say there's too much therapy, but some people can become too dependent on the process. And typically that's somebody who they may have a fear of going out on their own, and they've become so engulfed into the process where, they don't feel the confidence in order to step out. But and that piece of it, let me say this, that piece of it is all about the aspect that, we still have yet to get, and especially in Black culture, we all about resiliency. Mm-hmm. We could talk about resiliency all day. We know we can look at our scars. We can look at our scars and our wounds, and we can say, "I've been through these things, and I'm resilient because I go through this stuff." Right. But what if you can look at your scars and your wounds, and you say, "You know what? What I learned through this situation, from this scar and this wound, was I needed to do this, I needed to do that, and I needed to do this." And so the next time I experience and life start lifing, mm-hmm. I'm confident in my ability to function through that situation. That is called self-efficacy. Mm-hmm. And so as a therapist, it's my job to help teach. I show you resiliency, but I help to teach self-efficacy.
Is there a such thing as being healed from something?
So explain that further.
Or so you go to therapy to kind of heal from some trauma that you went through in your childhood.
Oh, so you say heal?
Yeah, healed.
You say heal.
Yeah, healed. Yes.
Yeah. Yes. Yeah. Yes. Healing is a process.
Right. So there's such thing as being healed from something.
Yeah, it's a process. Healing is a process, and healing doesn't look the same for everybody.
Right.
But yes, absolutely.
No doubt. Great segue into your services. Let the people know if they can hire you or where can they find you and everything, and let it out. Let the people know what's up.
So I am, my practice is in Norcross. I do have a office, so I do in-person and virtual services. You can reach me for services at my email, therapy@psychosocialcafe.com. You can also reach me, you can DM me. People DM me all the time on Instagram mm-hmm. at the Psychosocial Cafe at the Psychosocial _cafe. Okay. And then you can also find me on Psychology Today. You can also Google Holistic Partners Network, LLC. Most of the time, I'm the first person that pops up on Google. And then you can also find me on TikTok at the Psychosocial Cafe.
Okay, one more, real quick. I have a comment here. She said, "Speaking of trauma, more than once I've found peace with my traumatic experiences, and then years go by without a single symptom of PTSD, and bam, it comes back and slowly re-escalates. Is that normal?"
Yes, because it's not that it ever goes away. It just flares back up. It just flares back up. And so my advice to her would be, go back to the time that you found peace and use the tools, because you'll be able to pull those tools out to where you found that peace. If you've practiced a level of forgiveness, go back to that place of forgiveness. And it just flared back up. I wouldn't look at it as a bad thing. You're not decompensating. You have not regressed. Sometimes things just cause that PTSD to flare up, but I would not beat yourself up about that. You've gotten to a place of peace, and I would be confident in staying in that place.
No doubt. She said, "Thank you." Hey, man. Once again, where could they find you at now? Where could they book you at?
So they can email me at therapy@the-psychosocial cafe. Mm-hmm. You can find me. You can also find me on Grow Therapy.
Okay.
You can find me on Alma, Sonder Mind, and they could go find me on ZocDoc and Psychosocial and Psychology Today.
Oh, okay. And these are all places where you can go and research a therapist.
Yep. You can all, yep. These are all places you go research for therapists. Oh, and Therapy for Black Men. I'm on Therapy for Black Men.
Come on.
Or
man.
it don't even have to be me. If you're looking for a Black therapist, therapy for Black Men. If you're looking for a therapist for you, you're looking for a therapist for your boyfriend, your husband, the man that's in your life, go to Therapy for Black Men. It's a good place to find a Black male therapist.
Man, I had to write that down. That's what's up. That is what's up. Hey, brother.
Therapy. Yeah.
Okay, what you saying?
Therapy for Black girls too. Therapy
they have therapy for Black girls too?
Oh, you can find a Black female therapist. Yes.
Oh, say less. See, listen. Okay. Well, that's great, man. Brother, man, Mr. Marcus Jones, man, I appreciate you, man, for being on, man. You gave great insight as you usually do, as you normally do, man. And it's been always love, man. I'm a huge supporter of you, man. And man, I thank you, man. I'm glad we stayed connected over the years, man. And it feels good to see you really doing your thing continuously. And you about to be Dr. Jones next year. I cannot wait to call my brother Dr. Jones. Matter of fact, Dr. Jones, thank you so much for being on Be Clear Alert. Man, I really appreciate you, King, man. And man, we're gonna stay connected, brother. If you may have to have you come back on because it's so many people, man, that needs this, man. So, man, just be on the lookout, man, to be back on, brother, man, for real. I appreciate you.
Yes, sir.
I appreciate you, man. Thank you so much, man. Have a great evening.
Appreciate it, brother.
Y'all, man. Listen, thank y'all so much, man, for rocking now. This was dope, y'all. Thank y'all. Appreciate everybody that came on. I'm going to post a link inside of the description. So later on, come back to YouTube. It'll be there. I'm going to post it on my Instagram and my Twitter. So all that'll be there. Man, I appreciate y'all. Thank y'all so much. And I want to say, y'all, that, happiness is good, but I don't want you to lose yourself and just focusing on being happy. I appreciate everybody really taking time to really, making it about them, but I don't want you to lose yourself. I don't want you to, use people and abuse yourself and sell your soul in the sake of happiness, so just please be mindful of that. Okay. And once again, I need y'all to follow Be Clear Alert everywhere. I'm not on Facebook, but Be Clear Alert everywhere. This was another jewel. I appreciate you, man. I appreciate y'all. This was the one, bro. Yes, we're gonna get a part 2. Listen, this right here. Thank you. Thank y'all so much. Y'all been tapping in, man. Y'all been tapping in, and I really appreciate y'all. This is what's up. Mental health is really, really huge. It's something that we need to really speak about, more often, especially within the Black community. We don't really, we shun it still. We sweep it under the rug, but we're suffering, and we can't no longer, ignore, these things. We just can't. We're trying to prosper together. So, it's important to maintain good mental health. And it starts with what's on the end of that fork. We got to be mindful of what we put in our bodies, what we putting in our mind, what we reading, what we watching, the people we associate ourselves with. We have to be mindful of all of those things, y'all. If we're trying to maintain good physical, good mental health, we got to make sure that we keep a positive force around us. You know what I'm saying? So, just be mindful of that moving forward. But thank y'all so much for rocking out. Make sure you follow Be Clear Alert Podcast. This will be posted on Spotify if you missed it, or it'll be right here so you can replay it as many times as you want on YouTube and on Spotify, y'all, and on Apple and Google. So thank y'all so much. Y'all have a great evening, and I love y'all. Make sure y'all follow me, y'all. Peace.